This portion of CardioSource Video News is supported by the makers of Xarelto.
Welcome to ACC.12. I'm Dr. Randy Martin with CardioSource Video News. One of the really exciting late-breaking clinical trials today was the TRA-2P TIMI-50 trial, and I'm thrilled to be joined by the lead author, lead investigator, Dr. David Morrow from Brigham and Women's. David, thanks for joining me.
You're welcome.
So let me play ignorant and tell me what this trial was.
Sure. This was actually the largest trial we've ever done at TIMI, more than 26,000 patients, and we were studying a new platelet blocker. So totally different mechanism than our currently available therapies, specifically blocking thrombin's action on platelets. And it's called the protease-activated receptor 1 that mediates that. And this is a drug that selectively blocks that called Vorapaxar.
Okay. And David, this was a very large study. Tell me a little bit about its design.
It was. So we enrolled patients with myocardial infarction, ischemic stroke, and peripheral arterial disease. The MI group was really a core group of interest for us. So we enrolled almost 70% of the population was in that group. And we followed them for 2.5 years, long-term on top of standard therapy, Vorapaxar or placebo, randomized double-blind design.
And it was in 30 countries, a very, very sizable. So the obvious question is, what did you find?
Yeah, so our primary results showed a significant reduction in cardiovascular death, MI, and stroke with Vorapaxar on top of standard of care. And in the MI group in particular, which was a focus for us, there was a 20% reduction in cardiovascular death, MI, and stroke.
This secondary prevention, right?
Correct. So these are all stable patients. This is a switch to long-term mode. And I think probably one of the most important findings is that this is the first time we've seen that anything on top of aspirin is useful in that particular setting.
I mean, that's pretty dramatic. The obvious thing people always want to know, any negative effects or anything you saw that you learned?
Yeah, not surprisingly that when we're using a potent platelet blocker, we saw a balance with bleeding. And there was a significant increase in bleeding with Vorapaxar. And so if it were to be available clinically, you'd have to match the patient based on their ischemic risk and bleeding risk.
Was the bleeding risk heightened in the people who'd already had an ischemic stroke versus the MI population?
That was an important finding in this trial. So overall in the stroke group, we didn't see any convincing benefit, and we saw an increase in intracranial hemorrhage. So
in that group. So the next obvious question to me is, where are you going with this?
Yeah, I think we're still have an opportunity to learn much more. This is a huge database to find the right match of the patients where we think there's that right person to receive both the benefit antithrombotic while at a lower absolute risk of bleeding.
And the take-home message for the people that are watching this from this trial?
Yeah, I think most important is that we see that there's something to be had for long-term benefit in chronic secondary prevention on top of aspirin.
Super. David, great presentation. Congratulations on the trial.
Thanks
and we want all of you to continue to watch us and join us, because we'll be having more here for you at ACC 12 coverage.